Today I'm going to be talking about pertussis. So what is pertussis? Pertussis is a respiratory disorder characterized by a lot of secretions and a whooping cough. What causes this disease? Pertussis is caused by a bacteria called Bordetella pertussis. It has an incubation period between 7 to 10 days. And then cold-like symptoms will begin, and that will usually last for another 7 to 10 days, and then you will see the whooping cough itself begin. The cough has an actual whoop sound, and then when a child is coughing, they can cough for up to 10 to 30 times in a row. The child will appear very uncomfortable, and their face will get red, and this will happen on and off. You'll also see a lot of tears coming from their eyes, and secretions coming from their nose or mouth. And then this whooping cough can last somewhere between 1 to 4 weeks, and it can actually take the child weeks to even months to recover from pertussis. What can you do to treat pertussis? So focusing on treating pertussis includes antibiotics to kill the bacteria and then respiratory support. If your child is under 1 month, the antibiotic usually used is azithromycin. And then if they are older than a month, they can antibiotics can include azithromycin, erythromycin, and clarithromycin. Those are the commonly used medications. And then respiratory support as well. So to help the child with things like secretions, you're going to want to include giving your child lots of fluids to help thin their secretions. Because that can help with the mucus and things like that. And then you're also going to want to keep your child away from other people because pertussis is very contagious. So then also if your child is having difficulty breathing and difficulty browsing, make sure you take them to seek emergency treatment right away. And then what can you do to prevent pertussis? So there is a vaccination available for pertussis called the DTaP, which stands for diphtheria, tetanus, and pertussis. So they will receive their first vaccination at 2 months, 4 months, 6 months, and then between 15 to 18 months. And then a booster will be given then somewhere between 4 to 6 years before entering the school system. So pertussis is easy to prevent with vaccinations. And then once again, if your child is experiencing any of these symptoms, make sure you seek help right away.